It gives me great personal satisfaction to give the citation for this year's St. Paul's medalist. This medalist started her career at the University of Chicago, where she received a BA in biology and an MS in biochemistry. She continued on to the University of Chicago Medical School on the Medical Scientist Training Program, receiving her MD and PhDs in 1985 and 1987. After completing her urology residency at Northwestern University, she then went on to fellowship training in endourology and minimally invasive surgery at Washington University, St. Louis, under the direction of one of the giants in endourology, Ralph Klayman. Currently Professor and Vice Chair of Urology at the University of Texas Southwestern Medical Center, with a dual appointment as Professor of Internal Medicine in the Mineral Metabolism Center. Her research interests include evaluation of dietary and medical therapies for kidney stone prevention, assessment of outcomes for minimally invasive surgical treatments, and development and assessment of resident teaching tools. In 2003, this high flyer received the AUA's Gold Cystoscope Award in recognition of her significant contributions to the field of endourology. Peggy's commitment to our specialty has been immense. Having served on all of the recent AUA guidelines panels relating to stone disease, she recently chaired the panel on medical management of kidney stones, the latest update being last year. In 2011, she was elected to the board of the directors of the Urological Society and is currently in her second term as Secretary General. And it has been one of the highlights of my career to serve on the executive board under her guidance. Peggy's inclusive and engaging style has served us extremely well in these challenging times. Now, with over 145 publications in peer-reviewed journals to date, our medalist is known worldwide as the guru in the evidence base for the treatment and management of urinary stone disease, and has been a regular invitee to BAUS to share her knowledge and insight. The St. Paul's Medal is awarded to distinguished colleagues from overseas whose contribution to the association in particular, or to urology in general, BAUS Council particularly wishes to appreciate and honour. Peggy has been a frequent visitor to BAUS, where we have always greatly valued her knowledge and expertise. This year is no exception, and we proudly wish to honour one of the greats in endourology, Dr. Margaret Pearl. Peggy, it grieves me that you can't be here to receive this medal in person, but I assure you that it comes from the heart of everyone in UK urology.
Thank you so much, Adrian. It's such an honor and a privilege, excuse me, to receive this award. And it's really made all the more special because it comes from you, really one of my oldest and dearest friends in this society. I also want to thank Abe Rane, also one of my long-term friends in this community, who nominated me for this award and has also included me in so many BAUS activities through the years. My relationship with this community really goes back more than 20 years when I first visited the UK as a traveling fellow through the Royal College of Surgeons, and had the privilege of visiting with a number of leaders and innovators in the field of endourology. And that list included people like Graham Watson, Frank Keeley, Anthony Timoney, David Tolley, Sam McClinton, and the late John Fitzpatrick. Many of these individuals have remained my lifelong friends. And so again, I am so honored and privileged to receive this award, and I really look forward to continuing my relationship with the Society in the coming years. Thank you again.
Well, it gives me great pleasure to introduce this year's St. Peter's medalist, Professor Prokar Dasgupta. Prokar is perhaps best known to many of you as the editor of the BJOI for the past 8 years, but those years have formed just part of a highly distinguished career as a surgeon, an educator, and a leader in urological research. His urology practice started in the 1990s at Queen Square, where he explored the science and developed the technique of intravesical injection of botulinum toxin, now standard treatment for millions of patients with overactive bladders. He was appointed a consultant to Guy's Hospital in 2002, and rapidly became one of the pioneers of robotic surgery in the United Kingdom. He was awarded the Baus Golden Telescope in 2006, and he went on to be appointed Professor of Robotic Surgery and Urological Innovation, Chairman of the Institute of Robotic Surgery, and most recently, the Professor of Surgery at King's College Hospital. As a researcher, Prokar chairs the Prostate Cancer Research Centre at KCL and is also director of the MedTech Hub at St Thomas's Hospital. His academic output has been prolific. He's published over 1,100 articles, 35 book chapters, and has given over 800 lectures and presentations at scientific meetings. His achievements are internationally recognised, most noticeably with his membership both of the Association of Genitourinary Surgeons and the Academic Association of European Urologists. He is also acknowledged as a leading educationalist and a recognised leader in robotic training and an authority on the role of simulation in operative surgery, human factors and patient safety. He developed the world's first laparoscopic nephrectomy simulator. His tenure as editor of the BJOI was impressive. He doubled our impact factor, revolutionized the use of social media in publishing, and introduced the use of AI. Time does not permit me to expand further on his many innovations, his charitable activities, and his sporting prowess. So I simply commend him to you as a worthy recipient of the 2020 St. Peter's Medal.
Good morning, everyone. The other day, this beautiful St. Peter's Medal arrived from Baus. Feels very nice and heavy, and I'm really honored to have my name engraved alongside Peter Fryer and Harry Fennick. This really would not have been possible without my wonderful colleagues led by Shamim Khan. I only realized recently that each and every one of you individually signed my citation, for which I will remain forever grateful. For 25 years, I have been inspired by Professor Claire Fowler, Stephen Sachs, who heads up our Medical Research Council Center, and by so many of you, including my scientists, engineers, and students. None of this would have happened without my elderly parents who are in India, my godchild Velvet in Perth, wonderful wife Elizabeth for putting up with me. I say this to any young surgeon who wants to do well in life. This beautiful island that we live on provides us with boundless opportunities. If I could do it, so can you. Please do not be afraid to dream big. Please indulge me while I read a few lines from my favorite poet, Vikram Seth. This is from his book, The Suitable Boy, recently dramatized in 6 episodes by the BBC. To these I owe a debt past telling, my several muses, harsh and kind, my folks who stood my sulks and yelling, and in the long run did not mind. Dead legislators whose orations I have filched to mix my own potations. Indeed, all those whose brains I have pressed, unmerciful because obsessed. My own dumb soul to say to you, thank you so much.
Well, good morning, ladies and gentlemen. In 2008, the then President Tony Munday and Baus Council agreed to institute a gold medal designed to complement the St. Peter's Medal, and it's awarded to an individual who's contributed to the development of British urology as a corporate entity. And this year, I'm delighted to do the citation for Simon Harrison. Simon initially went to Sussex College in Cambridge and then qualified from the London Hospital in 1979. He subsequently undertook training posts in Cambridge, Norwich, Bristol, and Taunton. And during that period of time, completed a thesis on the denervation of bladder outflow obstruction in the urinary bladder. Following this, he was appointed as a consultant in Pinder Fields with special interest in spinal injury. Simon's consultant career was illustrious in lots of different ways. He was executive member of the Bowes Association Female Reconstructive Urology and subsequently became chairman between 2008 and 2010. He also served on Bowes Council. He was chairman of the Guidelines Development Group of NICE for incontinence in patients with urological disease. And he subsequently served on the editorial board of Neurourology and Urodynamics. I think in 2016 was a pivotal moment, both in Simon's career and for British urology as a whole. For in 2016, he took over as the clinical lead for GIRFT, the Getting It Right First Time in Urology. Between 2016 and 2018, Simon undertook in the region of 134 visits to hospitals in England, gauging the temperature of British urology and resulting in a seminal document in 2008, which for the first time encapsulated what was going on in the specialty. And in it, with an underlying evidence base, he argued for the increased provision of urological investigation units. He also showed that there was substantial variation in the way in which urological services were being provided. And this has provided an nidus for the improvement of services throughout the UK as a whole. Simon hasn't hung up his boots yet. He has agreed to stay on and continue to work with GIRFT, and no doubt will contribute significantly to the specialty in the future. Simon is modest, self-effacing, and enjoys a huge respect throughout the country. And his report into urology really sets the scene for the specialty in the years to come. So I'm absolutely delighted to present Simon with this award on behalf of Bowes. He's done so much to earn. Thank you.
Well, Kieran, thank you so much for that kind and flattering citation. It's much appreciated, and heartfelt appreciation also to Bowes for, by magic, this medal now appearing over here. Being awarded the Bowes Gold Medal is very special, and I'm very honoured by that. Now, anything I've achieved for British urology has been achieved through working with teams, and Kieran's already mentioned many of those. So it was a real pleasure and experience to work with Bowes Council and then to serve on the committee of the section of female neurological and urodynamic urology. These are excellent people to work with. And then the privilege of working with NICE on the guideline that was mentioned. And particularly, I've enjoyed over many years working with the team in Sheffield, David Thomas and Paul Topple in particular, on the spinal injuries course, which has run for many years. And then latterly, the Getting It Right First Time project has been just a fantastic experience and hugely rewarding and satisfying. But I think as a consultant urologist, you end up with two families, the work family, in my case, the urology department at the Mid Yorkshire Hospitals Trust. And they have been truly spectacular over the years, consultants, theatre staff, ward staff, urodynamic staff as well, all looking to provide care of the highest standard and constantly searching for ways of doing things differently and better. So real inspirations. And then finally, my true family, my wife Jackie, children Sam and Kate, who've provided the balance and support which has been so essential over these years. So a heartfelt thank you to one and all.
My name is David Thomas, and I would like to give a citation for Chris Harding, who's this year's winner of the Carl Stortz Harold Hopkins Golden Cystoscope Award. This is for outstanding contribution to urology over the first 10 years of consultant practice. It's an additional pleasure to see the Golden Cystoscope returning back into my adopted Northeast. Chris is well known to most of you as an outstanding young academic urologist. He's known to others for his slightly unreliable racing tips. Chris was appointed as a consultant to James Cook University Hospital in 2011. He was a Cambridge graduate and completed his urology training in the Northeast. He then moved in 2012 to join the late Rob Pickard at Freeman Hospital, and he became a close friend to his mentor, Rob. Chris has been outstanding in many fields, as a clinician, as a clinical researcher, as an educator, and for his contributions to BAUS. As a clinician, he leads a tertiary referral centre in the Northeast, delivering bladder reconstruction, complex fistula repair, mesh removal service, artificial sphincters, and PNEs. He's continued on Rob Pickard's practice, delivering a very holistic and patient-centered supportive service. In terms of clinical research, he's lead for the Urology Clinical Trials Unit in Newcastle. He's generated over £5 million in grants. He supervises students at both PhD level, MD, MS, and BMed Sci. He's been chief investigator for 4 large national trials, HATPIN, ALTA, Masters, and Primus. He's published 40 papers and has 70 published abstracts. As an educator, he's developed the Royal College of Surgeons approved Reconstruction Fellowship at Freeman. He's delivered numerous urodynamics courses and has been masterclass faculty on a regular basis in reconstruction and urodynamics. In BAUS, he has been chair of the FNUU section, a chairmanship he carried out very successfully, and he's also contributed to the audit and research committees. One of his greatest contributions has been as mesh lead, advisor to the Cumberledge report, where he's provided both supportive and sympathetic approach to patient groups, as well as providing objective feedback from the clinical data. So I cannot think of a more deserving candidate than Chris, and I would like to wish him my congratulations for this year's Golden Cystoscope Award. Well done, Chris.
Thank you, David, for those very kind words. I'm absolutely delighted to win the 2020 Karl Storz Golden Telescope Award, and I was particularly overwhelmed when I looked at the list of previous winners. There are a few groups of people who I'd like to thank. Firstly, I'd like to thank my family for their unwavering support. And secondly, I'd like to thank my work family, the entire team at Newcastle Urology, who have supported and encouraged me during my first decade of consultant practice. I'd also like to thank all the people who've mentored me over the years during my training in East Anglia, London, and more recently the Northeast. Special thanks go to the BAUS staff who've had to put up with my 6 a.m. emails and my late evening phone calls during what's been quite a testing time for functional urology. Finally, I'd just like to dedicate the award to 2 men who are no longer with us, but have played an enormous part in my life, my dad and the late Professor Rob Pickard. Thank you.
It is a great pleasure and honour to read the citation for my friend and colleague, Tamsin Greenwell, for the John Anderson Medal. Tamsin trained in Manchester for undergraduate studies and house jobs. She moved to do her MD in Sheffield and stayed for her CT jobs and a registrar in general surgery. She was the first group of the Cowman trainees appointed to London South in 1996, an iconic year when she got married, passed her driving test, and moved south to spend a year at Brighton and then to Guy's, where we first met. Admittedly, a little stormy at first, but now a very dear friend. This was followed by 2 years at the Institute of Urology, where she worked for Peter Worth, Tamsin's most important mentor and friend. She received the Keith Yates Gold Medal in the FRCSU role. Jason and Tamsin then spent a year in Brisbane, where she worked for David Nichols, who was apparently so impressed with her that he followed her back to London to see if all the UK trainees were as good. She finished her training at Great Ormond Street and UCL and was appointed definitively at the Institute in 2003. At the Institute, Tamsin has strengthened the FNU unit by appointing 4 excellent colleagues, expanding the nursing and allied medical workforce in number and remit, and including the urogynecologists in the team. This has established it as the unit as a leading force in the UK. The unit continuously has strong academic output and has established itself as a national centre for specialist FNU surgery, and more recently as a mesh removal centre. Tamsin has always been actively involved in teaching, running the internationally renowned masterclass in female urology, which many of us have benefited from attending. In her early consultant career, she was specialty tutor at the College of Surgeons, attracting significant funding and introducing a raft of new teaching courses. And then Director of Education at BAUS. She is now on National Selection Panel and an examiner for the FRCSU role. Nationally, she was chair of the FNU committee from 2015 to 17. During her tenure, she improved the teaching programme at BAUS, helped establish the audit database, and led on the BAUS information leaflets for the section. Recently, she's been on a working group set up to set the specifications for the mesh removal centres. Internationally, her reputation continues to grow. For example, she's on the GERS committee and the EAU urethral stricture guideline committees. I admire her bravery, standing up for her patients, colleagues, and herself when needed. She's been a big supporter of women in urology, proving it is possible to have a career in urology and a family, and still have time to buy 130 pairs of shoes. No one is unaware of Tamsin. Her presence is always fun, and as a consequence, she has many friends in urology and beyond. I believe she is greatly deserving of this award.
Thank you, Susie, and thank you, BAUS. I'm incredibly honoured to be this year's recipient of the John Anderson Award. I've been a doctor now for 30 years and a urologist by intent and then by name for 29 years and 50 weeks of those 30 years, after starting my very first house job in urology at the old Salford Royal Infirmary. Urology has without doubt been an interesting and extremely fulfilling career. I'd like to thank all of the surgeons and urologists who trained and inspired me to pursue urological surgery as a career. I'd also like to thank the very many fellows and trainees I've had in FFI urology at UCLH. They've been a pleasure working with, and they've taught me almost as much as I've taught them. I'd like to thank my urology peers and friends who've helped and supported me from day one as a consultant, both surgically and psychologically. That one's for you, Susie. I'd also like to thank my family, because without them, there is no me, and they're just great. I'd also like to thank the whole of the FFI urology team at UCLH for just being superb in every way. Finally, I'd like to thank my amazing colleagues, Jeremy Okrim, Rizwan Hamid, and Maureen Paxad, who've all been my trainees and are now my peers, my friends, and my inspiration. Thank you.
Okay, so I'd just like to thank BAUS for sending me the Keith Yates Gold Medal, which I've just received in the post. It was a combination of a very difficult year with a lot of hard work, and I was absolutely delighted to receive the Keith Yates Medal, which I was really very humbled by. I'd really like to thank all of my trainers in the Northwest region, particularly within the Northwest region. You know all who you are. Thank you very much for all of your patience and your kindness over the course of the last few years during my training. I'd also like to thank my long-suffering wife, who I basically ignored for about 12 months, but she put up with me, and it was worth it in the end. So thank you very much, and thank you to all my mentors and trainers.
So I'd just like to say a huge thank you, firstly to my colleagues who nominated me for the Bronze Cystoscope Award. It's a huge privilege to receive the award. It arrived on my doorstep this morning. I feel very humble. I'm sure there's a lot of other trainees out there who've done a lot more than I have, but it's a really nice feeling to be recognised for some of the work and things that I've tried to do. But I'm really just grateful to both BSOT and to all my colleagues that I've worked with. So thank you.